Hello, my name is Dr. Sandy Juste, and I am currently a behavioral health ambassador for the HBCU LEAP initiative based out of Clark Atlanta University. Welcome to the Meet the Mentoring Corps Leader Series. I am a PGY3 psychiatry resident here in Nashville, Tennessee at Meharry Medical College. I'm originally from South Florida, Fort Lauderdale to be more specific. That's where I was raised and where I went to middle school and high school. I went to the University of Florida for undergraduate studies, and then I went off to Georgetown University where I did a master's in physiology. Before going off to medical school, I was a middle school science teacher for about 3 to 4 years. So why I chose this field was because I come from a culture where mental illness is feared and, just misunderstood, and there's lots of misconceptions, and just mental health in general isn't prioritized. I am of Caribbean descent. More specifically, I'm a daughter of 2 Haitian immigrants, so I am Haitian American, and I just recognized that there was a need for more people who look like me to be in this space where we could diagnose and treat people of mental illness. As far as my research interests and behavioral health topics that I'm more interested in, I would say I'm definitely passionate about mental health equity and disparities within mental health and just minority mental health in general. Specifically, I'm looking to go into child and adolescent psychiatry, where I would do a fellowship for 2 years when I'm done training in general adult psychiatry. I'm also really interested in women's mental health, such as just reproductive and perinatal psychiatry. I'm interested in mood disorders, as well as trauma-related disorders and anxiety. I also have a passion for addiction as well. For example, Thursday mornings this year, I spent some time in the Suboxone clinic helping to diagnose and treat opioid use disorder, as well as co-occurring substance use disorders that those patients may have. So these topics are just really to accomplish. Ultimately, my main goal is to contribute to mental health equity. I hope to work with underserved populations. I also hope to work with the Caribbean population. I think that, I want to see patients across the lifespan, and that is why I'm going into child and adolescent psychiatry. I think it's very important to intervene early. I think the earlier we intervene, the quicker we can get our patients in specialized services, and the better the outcomes. And so I'm also hoping that to some extent I can work with school-based mental health, as well as work with transitional age youth. I think my biggest motivator these days is just the satisfaction that I get out of helping my patients just live better lives and just having a better outcome. In addition to that, my faith, everything I do is rooted in my faith and my belief in God, and to just, want to do good and contribute to society and just, be a good person. And so I would say those are sort of the things that sustains me and what motivates me. But the biggest thing right now is staying in this field is that you really do make a difference. You really do help patients feel better, have a better quality of life, and just better outcomes. And then what's the biggest misconception that people probably have about me, or more specifically my patients probably have about me, is that I'm too young to be a doctor. I get it all the time when, patients come in and they're like, whoa, you're the doctor. You look like you're, in your teenage years or in your early 20s. And then I'm open about my age, and so I tell them how old I am, and it usually catches them off guard and they're really surprised. And so I think that's the biggest misconception, that I'm too young to be in the position that I'm in, and just too young to be a doctor and to treat and diagnose patients. And then some fun facts about me, I would say one thing that's really cool is I've traveled a lot, and so I think at this point I've probably been to close to 30 different countries and islands. I've also lived in 2 different countries outside of the United States.